So we've designed this fairly rigorous testing protocol where we're bringing people that have had this procedure back into the lab here, the human performance lab. We're putting them through their paces, trying to replicate functional tasks like they would expect to put the knee through when they're partaking in sport.
Nobody so far has been able to publish evidence and information relating to detailed biomechanical analysis. So it's fantastic that William Wilson has taken time in his PhD to focus on the biomechanical function of patients after internal brace repair and comparing with reconstruction. I think the evidence that will be produced and subsequently published will change orthopedics internationally. It's that important.
Our first participant today is Lauren Perry. She's the goalkeeper for the Northern Ireland international team.
I did my ACL by catching the ball over my head, and I landed on my right, came onto my left, and I went to run away and my knee went the opposite way. All my teammates thought that I was just kind of lying there, but I heard a pop, and because I heard a pop I kind of knew that I'd done something quite serious.
Well, it's very hard objectively to assess someone's balance, for example. That might be dependent on the nerve fibres within your knee and the feedback, the sensory feedback you get. But we can objectively do this here with the technology that we have. So subtle changes in terms of how we walk or how we jump or how we land can assess function, but it can also give us an indication about the risks of future injury.
Lauren's a year and a half now, almost, after her injury. In this session, we're comparing Lauren as part of another cohort of ACL repair patients who've had the internal brace. If the ACL is repaired, the nerve endings that were meant to be part of the anatomy are retained, and therefore, if that heals, the theory is that the proprioception, the feedback mechanisms might be better after the recovery, and that's something that we're really interested in.
Well, actually, my knowledge of the internal brace procedure was actually non-existent before William explained it to me what it was like, and he explained it in such a way that it would be like an extra safety net within the knee, and this should accelerate the whole rehabilitation process, which I later found out to be absolutely accurate, yes.
What's been really nice about Lauren is she's been very dedicated to her recovery, very focused, and I think that's why she's made such a smooth recovery, where she's focused her rehabilitation to match the speed of healing and recovery after injury, and I think that's why she's got such an excellent functional result.
Well, I'm back to where I was before I did my ACL. So I'm training 3 times a week, match at the weekends, and it gives me no bother.
We've published on the first cases that we've looked at with MRI scan and then arthroscopically to have a look inside the knee, and we showed that yes, the ACL can heal and a patient can do well after this.